this video lecture is going to focus on the conception portion of conception, pregnancy, and birth, which is the first life stage in our life course perspective. So some quick facts and just kind of acclimation to conception. I'm pretty sure everyone in this class knows where babies come from, knows how babies are traditionally conceived, and kind of the mechanics behind that. I think that's safe to assume, I would hope. At this point, we are aware of that. So the thing that does differ for conception is how culture and society views the context of conception. So whether, for example, a certain culture might only approve or deem it appropriate for conception to happen within marriage. Other societies and cultures may not care. They may not care about the genders of how conception happens, whether it's with a male and a female, or if it's through fertility methods. Age is another thing that culture dictates, how old a woman should be when they conceive and what's appropriate for that. I think it's quite funny that in America, if you have a child over the age of 35, you're considered to be a geriatric pregnancy, or as my doctor likes to call it with my last one, advanced maternal age, because that sounds so much better than geriatric pregnancy. And so there's some social constructs around what is appropriate ages and when is a risk age. Some of it's science-based, but some of it's also largely based around culture and perceptions of people. Another area of consideration of how culture can influence conception is the piece of birth control. And so some societies, especially it's influenced by religion, birth control is not looked upon as ethically appropriate or religiously appropriate. So Catholicism does not believe in birth control as an option. And so you'll see in societies where, or cultures or contexts that have a negative view of birth control as having higher rates of births in each family, and that's just natural because if there's no birth control, the rates of pregnancy, there's a higher chance of those occurring. There's also different types of birth controls that are permissible, and so we're going to talk a little bit more about them. Some of them are medical based, some are behavior based, and so sometimes one birth control might be more permissible than another. Another area of cultural influence is the proper behavior of pregnant women. And so there's a lot of movement in American society, at least, to provide education for women who are pregnant. So educating on prenatal vitamins, proper diet, exercise, and sometimes depending on socioeconomics and kind of location, availability of services, pregnant women might not have access to those services, and so they might not have the education about what is medically appropriate for behavior of pregnant women. A final area of consideration, again, this is not a comprehensive list, but these are just some things to think about, is where and how childbirth will occur. And so there's the options for having it in a hospital setting. There's the options for home births, having a midwife, having a water birth. There's some social stigma around having a C-section versus a natural vaginal birth. Is it appropriate or inappropriate to get induced? Some societies and cultures do not have all these medical options. And so if you think about women who might be in a rural African country, they might not have access to a hospital. And so home birth and midwives in natural labor are the only option. And so what happens when there's a medical necessity for something more intense and those options just aren't available? And so these are all different pieces that are good to kind of keep in mind and consider when we're thinking about pregnancy, and if our clients that we're working with happen to become pregnant or are some way enmeshed or entwined into a situation where pregnancy is, it's good for us to kind of realize that there's a bigger piece and picture to it than just basically having sex, becoming pregnant, and having the baby. And so you can see on the bottom of this, it talks about how the conception experience is also influenced by religion. And so I kind of mentioned that earlier with the birth control piece. But the mindset may be that religion is telling you that sex is only for marriage, and so babies only can be within marriage. And is sex used for just pleasure or procreation or perhaps both? religion often has a big influence in how people perceive and view sexual intercourse and the road to conception. So, the social meaning of childbearing in the United States. So, I kind of mentioned a little bit more globally in the last slide, but if we're going to look specifically about how childbirth and kind of some trends that are happening within the United States, kind of largely influenced by the current cultural context and social constructs that we are experiencing. So I'm going to go on the slides from the top, just go through them, and I'll go through on the bottom too. So we're going to start with talking about how birth control options have expanded, which is wonderful. And so birth control is not just limited to taking the pill or pulling out or withdrawal methods or how. I just said that twice. We're actually going to talk about, the book listed a ton of birth control methods, and we're going to talk about that on a different slide. And so the options have expanded, and so traditional methods or ways that have worked in the past have expanded, and so that's a positive. But also on the negative side, sometimes all these options are not available universally, and so is privileged playing a part of how accessible birth control is, and is that fair? Is that taking away a basic human right? And so those are things to consider with that. The next one, marriage rates have declined and more children are being born to unmarried mothers. And so this is kind of a cultural shift where it's not necessarily as taboo to be a single mother or to get pregnant outside of marriage. There's still some implications if your religious beliefs align with having pregnancy within marriage. There's some influence of that as well. But as a whole, we're seeing in the American society that the trend is shifting to not having a two-parent household, and there's a lot more single parent, specifically single mother households, where women are getting pregnant using fertility options and not necessarily having a male or female partner in the picture. And that kind of leads me to the next one, which is it's becoming more common for gay and lesbian individuals and couples to become parents. And so if you're thinking about lesbian couples, this is often through in vitro fertilization, the different fertility methods that involve having one of the females in the relationship use their eggs, have a sperm donor, and then having a biological child for one of the mothers and having the other mother adopt the child. And so having that same-sex relationship and then both being parents in that manner. It is a very complicated and interesting process for lesbian and even gay couples who where only one of the couple has biological rights per se to the child, and then the impact that has on the non-biological parent having to adopt, go through those hoops, and some of the psychological impacts that can have. It's really interesting. There's also the route of adoption to gay or lesbian couples or individuals that they're able to go that route. So similar to heterosexual couples having the adoption but not necessarily having it be the biological child. And so that can get a little interesting too, because some adoption agencies will not allow same-sex couples to adopt. And so that kind of goes back to, like, is that discrimination? Are agencies allowed to do that based on their own agency beliefs and stance on it? It can get a little interesting in that aspect as well. It actually was a rather present topic in our West Michigan area because Bethany Christian, local adoption agency, has a specific stance on same-sex adoptions and how that can and that actually, it triggered a lot of conversation in the community about discrimination or in religious rights. So it's pretty interesting. It's a pretty current and relevant topic. So if we go down to the green box on that side, so talking about how teen pregnancy as a historical low, that's pretty awesome, I think, and that can be for a lot of different factors. It can be more access to the birth control, better sex education programs, teens just not being interested in having a child. Maybe we can attribute that statistic to MTV's Teen Mom. I don't think so, but you just never know. So seeing the depiction of the difficulties that teen pregnancy can bring, There's also some trends where teens are just not going out as much and they're staying home more. And so there's less chance of becoming pregnant if you're hanging out with your parents and staying home, and perhaps having more of a digital relationship with your boyfriend versus an in-person one. So we're gonna actually talk about that more when we get to the stage of adolescence. But that is I think a promising trend, because teen pregnancy comes with a whole another set of concerns and different things to navigate. And so teen pregnancy declining is a positive trend. The blue side, childbirth is more commonly delayed, or people are remaining childless. And so there's that shift in the cultural belief that you have to become pregnant or have kids, and that is one of the pillars of fulfillment. Not necessarily a trend that we're seeing in the United States. It's becoming more socially acceptable and normal to not have children, and also waiting till further in life. There's trends where females will freeze their eggs because they do not want to have a child in their 20s, or they're not in a relationship in their 20s. And they're worried about the viability of their eggs down the road, and so they freeze their eggs and then have a child down the road. Again, there's a whole nother ethical piece to consider with that. What if you don't use your eggs? Is that aborting a child? Lots of different pieces down the road, but it's becoming more and more common for delayed childbirth. And medical advances, I think, allow women in their later years to be able to safely have pregnancies as well. Again, like I said, geriatric pregnancies are considered 35 and above, and so there's more medical advances that can help have safer pregnancies later into adulthood. And then the last one, parents are less subject to traditional gender role stereotyping, so you see a lot more, it's a big shift from not just having fathers going to work, mothers staying at home with the children, mothers doing the dishes, cleaning the diapers, doing the laundry, feeding. Fathers are making the money. You see a lot more working mothers. This opens up the conversation to FMLA, so family medical leave of absence, maternity leave. Right now, women are allowed to take 12 weeks under FMLA after the baby as part of their maternity leave. Although if they do not have short-term disability, that is unpaid. And even with short-term disability, you're looking at maybe a 60% of your income during that time. And so there's financial things that come into play, like, is that feasible for a family to not have the mother's income for that time? Can they do it? And then if they can't, is there a push to get the female to return to work earlier than physically and emotionally and mentally they are ready to? There's a lot of bonding that goes in during the first 3 months of post-birth, and taking the mother away from that, is that healthy for the mother and for the child? America actually has one of the crappiest maternity leave plans. Some places will allow a full year paid after birth as part of their maternity leave. America is one of, I think, the only 2 that does not have a paid maternity leave, which is awesome. So if you're thinking about more of macro social work and advocacy, that is a beautiful area of advocacy, because maternal health is very, very important. And as we start to talk about the infancy stage, we'll see how important that the mother's mental health and emotional stability is really important for the development in the first months of the child. So that is an introduction to conception. I'm going to do a part 2 where we talk about conception methods and birth control methods. So look forward to that.